Hi, everybody. Welcome to my presentation today on plantar fasciitis. In case you didn't know, my name is Nancy Redick. I'm one of the physical therapists here at our Leroy office and also our office in Batavia. A little bit about me. I graduated Nazareth College in 2002 with my master's degree in physical therapy, and I've been a staff physical therapist here with Village Physical Therapy since 2008. Going between our Leroy and Batavia offices. Areas of interest for me, I really like dealing with post-operative patients. Right now we have a lot of knee replacements in our Batavia office, which is my favorite. And also I enjoy treating patients with low back pain. So today we're going to talk about plantar fasciitis. Some of you may be familiar with it if you've experienced it. Some of you may not. As you can tell by the picture, it involves the foot. So the definition of plantar fasciitis is an inflammation of a thick band of tissue that connects the heel bone to the toes. You can see there in the picture where that kind of red area is. That's the insertion of that plantar fascia. Causes. The main cause of plantar fasciitis, the plantar fascia is designed to absorb the high stresses and strains we place on our feet. So when too much pressure is placed on this area, inflammation occurs, resulting often in pain and stiffness. Some risk factors for plantar fasciitis. In most cases, it can develop without a specific incident or trauma, but there are some factors that can make you more prone to the condition. So for example, if you already have some pre-existing tightness in your calf muscles, obesity, so those of us that are overweight, high arches, repetitive activity, so those of you that are walkers, runners, you're definitely a little bit more susceptible to plantar fasciitis. Those of you that have poor fitting footwear, those that are over 40, and occupations that involve prolonged standing. Some statistics about plantar fasciitis. The most prevalence of plantar fasciitis is in those who are aged 45 to 64. It's also known that females are 2.5 times more likely to report plantar fasciitis than males. And about 10% of the population will suffer from plantar fasciitis at some time in their lifetime. Common symptoms. Pain is usually felt on the bottom of the foot near the heel. Sometimes pain can progress out into the arch area. Pain is noticed with the first few steps after getting out of bed in the morning or after a long period of rest. And this pain can usually subside after a few minutes of walking. And pain is usually greater after exercise or activity, not usually during. Diagnosis. Although I am biased being that I am a physical therapist, I think we're great at diagnosing and treating musculoskeletal disorders. So often we're the first place you should go. But it can also be diagnosed by your primary doctor, orthopedic doctors, or other medical providers. And oftentimes, imaging studies are not necessary. People ask that a lot, but they're often not necessary. So some common findings during the physical exam. One common finding is point tenderness at the base of the heel, so near that insertion of the plantar fascia. Some tightness with dorsiflexion. Oftentimes that's described as pulling the foot upwards. So like when you're walking and you bring the toes upwards, when you go to take a step, we call that dorsiflexion. Also, we notice that people tend to have very high arches, or the other aspect of that would be very flat feet. Both can cause many foot problems besides just plantar fasciitis. Weakness in the ankle or foot is often noted, and also decreased balance. And another common finding we'll see during the exam is just poor current footwear. There's a couple slides coming up. We'll show you some pictures of some poor footwear, which unfortunately I see quite a bit in the office this time of year. So we'll talk about that here in a minute. Some common treatment options. Medication is often prescribed. Often it's an anti-inflammatory of some sort, perhaps muscle relaxers. Also an option could be surgery. Or a specific procedure where they actually cut part of the plantar fascia. Injections, you can see that nice big needle there. That's very common as well, an injection into the heel. And also my favorite option is physical therapy. So what can physical therapy do? Well, there's a lot of things. First and foremost, we can help you to diagnose whether you have plantar fasciitis or not. But we can also teach you stretching exercises that involve the calf musculature as well as the plantar fascia. We can instruct you in proper use of ice, or what's called an ice roll. So an ice roll would be filling up a small bottle of water and freezing it. That works great. As far as ice, you can use any type of ice. Put it in a plastic bag. You could use frozen peas, frozen corn, make your own ice pack. Works really well. Massage or manual therapy techniques. This is a big one that we do here in the office. Lots of people like massage, but it's very important for the foot and that plantar fascia to get in there with some skilled hands to help relieve that tension in the area. Activity modification is also something that we can discuss with you based on your activity level. And then another one that's very common that we do is called low-dye taping. So it's a specific taping technique for the foot and to give you arch support. Also, there will be a recommendation most likely for either over-the-counter or custom arch supports, depending on your tolerance to the taping. And also we can utilize modalities such as ultrasound, electric stim, and iontophoresis. Iontophoresis is something that I haven't used actually in a couple of years. It involves a medication that has to be prescribed by your doctor, and sometimes it can be a little difficult to get. But to be honest with you, we've been getting pretty good results. I think just doing massage, stretching, and taping, that I haven't found that it's always necessary to utilize that option. But otherwise, ultrasound I think is a little more beneficial than electric stim. So we use that quite a bit as well. So a plantar fascia stretch. Basically for this stretch, what you're going to do is you're going to cross your affected leg over the opposite leg. And just like the picture shows, you're going to grasp the base of your toes and pull your toes towards your shins until you can feel a stretch in the arch. If it's an extremely painful stretch, I usually recommend people start this out a little slow, maybe hold for 10 seconds. But ideally, you want to be able to hold for about 20 to 30 seconds and repeat that 3 to 5 times, at least 3 times a day. Often we recommend more depending on how relieving it is. A good question to talk about here is often people will say, well, it hurts. How much should I push it? My recommendation is usually I tell people, go up to that pain threshold where you feel it's uncomfortable, but don't push through it. And the more you stretch, the better it should start to feel over time. Also, this is another common stretch for the ankle and foot, which some of you may or may not know, the gastrocnemius stretch. Your calf muscle is actually made up of 2 muscles. One's called the gastroc, one's called the soleus. So this particular stretch in the picture on the right is just a standard gastroc stretch using the wall. So your affected leg is the foot that goes back, and you want to make sure you keep your heel on the floor, keeping your foot turned slightly outward. I actually prefer to keep the foot pointing directly straight towards the wall. And you're only supposed to do this one once that non-weight bearing stretch is tolerable. So this can be a little bit too painful to start out with. So the picture on the left is a towel stretch. So what you can do is either sit on your bed or put your leg up on another chair. You grab a nice big bath towel, loop it over the ball of the foot, and then you relax your foot. Using your arms, you're going to pull your foot towards you until you feel a stretch in the back of the calf. And you can see in the picture, the gentleman's foot is coming up off the table quite a bit. That's also fine. But as long as you're feeling it in mostly the calf for this one, you know you're getting a good stretch. And once again, it doesn't say here on the screen, but 3 to 5 repetitions. Try to hold for a minimum of 10 seconds, but really you want to try to hold for up to 30 seconds. And once again, we usually recommend 3 times a day. One of my favorites for this, this is a great way to do a self-massage. If you remember earlier, we talked about an ice roll, which is basically taking a bottle of water and freezing it. I actually kind of prefer just to use regular ice, and then I like to do the massage using a tennis ball. I've had some patients tell me they use a golf ball. I think that's a little too rough. I much prefer the tennis ball. So what you do with the tennis ball is you just put your foot on top of it and you roll it all along your arch. You can do circles, up and down, sideways, diagonal, whatever feels good. and you're going to do that for about 5 minutes. And once again, apply as much pressure as tolerated. Is not necessarily the more painful, the better. Just do what feels comfortable. So low-dye taping. This is definitely something we use a lot in the office. Once in a while, I'll have some patients that have some sensitivity to adhesives, so unfortunately, not a good idea to be putting tape on your foot for an extended period of time. But I've gotten some really good results with the low-dye taping. And in fact, a couple patients have learned to do it themselves. It's a little tough, but it's definitely doable. So basically the low-dye taping, we use just regular 1-inch wide athletic tape. And there's several layers of tape that go across the arch of the foot, and there's a specific pattern that we use to do the taping. It's pretty easy, and once again, depending on how tight or how not tight you want the tape, we can definitely adjust that at each session. Usually for the tape, we tell people to leave it on as long as you can. Usually it's about a day, and then when you shower or anything, the tape comes off. But we do that quite a bit here in the office. Arch supports. I've read a lot into some studies about arch supports, and there's not really, from what I'm seeing in the literature, there's too much difference in outcomes between over-the-counter and custom. I kind of find that a little hard to believe because I would like to think a custom orthotic is obviously shaped more for your foot. And like many things in life, you pay, what you get is what you pay for, right? I think you're probably better off to do custom orthotics, but I always suggest doing just an initial over-the-counter orthotics just to see if you get some relief. So the picture that I show here, these are actually called Spenco, S-P-E-N-C-O. You can probably order them online. And, you know, over-the-counter orthotics are a lot cheaper than custom. If it's something that you don't think you're going to stick with, obviously that's a good first option. I've used them myself, but Spenco is a really good brand. They're green, that's how you know they're Spencos, but I'm pretty sure you can still order those online. As far as custom orthotics, those usually have to be done at an orthopedic ankle specialist's office. Sometimes an orthotist will do them. I know my husband just had some done this year and he went up to Rochester. Can't think of the doctor's name, but that doesn't matter. But there's lots of places available where you can get custom orthotics. So a couple of pet peeves I have with footwear. This picture on the left obviously shows a bunch of sneakers. And then you can see a gentleman wearing, I can't remember what those things are called, but they look like a glove for your feet. Chances are his feet are going to be killing him after he runs, would be my best guess. Those are definitely very poor fitting. The picture on the right, one of my biggest pet peeves, especially when I see some younger kids come in, is they wear these boots that you see there on the bottom. I believe they're called bear paws or bear claws. Absolutely no support whatsoever for your feet. Not a good option. And then of course the Adidas sandals. Once again, they're very flat. All those little bumpy plastic things look to be fairly uncomfortable, but absolutely no support for your feet in something like that. So best option is always a good pair of well-fitting sneakers. As far as brands, you know, whatever feels comfortable for you, whatever you're used to buying, just make sure that it looks like it's quite supportive. All right, so how can we help? If you're experiencing any foot or heel pain that's not improving with self-treatment, we're always here to help you. And I feel that we unfortunately, we definitely have more of an individualized approach here at Village Physical Therapy than a lot of clinics. So that's one thing I think we're quite proud of here. So I would encourage you, if you need some help, please make an appointment or contact us, and we'll try and get you going on the right course to treatment. So call one of our offices. I'm here in Leroy and also Batavia. I'll see you've got our email there if you need to, there we go, if you need to send us a request. So one thing we also have here at Leroy, or excuse me, at Village Physical Therapy, since 2006, New York State has allowed for direct access. What that means is that you can come to physical therapy and receive treatment for 30 days or up to 10 visits, whichever comes first, before you would need to get any prescription from your doctor. So that's a great opportunity if you need to get in, especially quick, and not have to wait and go through your doctor's office and all that. So thanks for attending. Hopefully this was informational. And obviously you can't ask any questions, but if you need anything, give us a call. Thanks.